Welcome back. August is designated as National Breastfeeding Awareness Month, and the good folks at Turo want us to know of the 4 million babies born in the U.S. annually, 77% of newborn infants are breastfed. In observance of the month-long campaign, hospitals and birthing centers are celebrating the rising rate of infant breastfeeding and health benefits of the mother-baby bonding. Breastfeeding is the best way to feed your baby, but making the decision to do so is a personal one. So here to tell us more about all of this is Turo's licensed lactation consultant and family birthing center representative, Kimberly Benedict. Good morning and thanks for coming on.
Thank you. Thank you for having me.
Now, breastfeeding really is a wonderful thing that you can do for your child. The benefits go on, and it seems like we keep hearing about more and more every day. But tell me a little bit about why it is so good for the baby.
Well, breastfeeding is one of the greatest health advantages that you could provide for your infant. Studies show that breastfeeding a baby helps reduce the incidence of ear infections, of diarrhea illnesses as a young baby. It can reduce the incidence of asthma, diabetes, and certain childhood cancers for children. So it's really got great health benefits.
Yeah, and it's really the perfect balance of what the baby needs.
Absolutely.
I mean, breast milk is kind of like nature's perfect food.
Absolutely.
For a child.
It's always, provided in the right amount. You don't have to heat up a bottle. It's always there, and it just makes it easy once the mom gets accustomed to those early weeks.
Yeah, absolutely. There's some benefits for mom as well.
Absolutely.
And it's like such a great weight loss plan.
Yes, absolutely. Breastfeeding really helps to the mother to lose a lot of the pre-pregnancy weight or a lot of the pregnancy weight, and they frequently get back to their pre-pregnancy weight quicker than moms who don't breastfeed. In addition to that, breastfeeding helps reduce the incidence of certain types of cancer in the mother, osteoporosis, and diabetes, type 2 diabetes.
Wow, wow. And then there's obviously just kind of the bonding aspect
Absolutely,
of it.
Yes. It really helps the mom and baby form that bond in those early weeks, and really kind of, in addition, helps mom get a little bit of rest, because she's forced to sit down and nurse the baby, and it helps those hormones kind of help her to relax.
Oh, interesting. Very cool. Now, breastfeeding is one of those things I think a lot of people assume the baby pops out and you start breastfeeding and it's just like that. That's not always the case.
That's right.
It can be difficult. There's a reason you have lactation consultants out there to help. Hospitals have the support. But if a mother is kind of deciding, and it is a very personal decision, if they want to do formula or breastfeed or some combination of the two, how does that mom need to prepare? What do they need to know? And what do they need to do to prepare the hospital and the doctors? And
right. So mom needs to, we offer a prenatal breastfeeding class, and a lot of moms come to that to just get some good information about what to expect in those early days and weeks after they give birth. When the mother gets to the hospital, she should tell her healthcare provider and the nursing staff in labor and delivery that she plans to breastfeed. And oftentimes what they'll do, if mom has an uncomplicated delivery and the baby's healthy and both mom and baby are stable, they place the baby skin to skin on the mother's chest, dry the baby off to prevent heat loss. The skin to skin helps calm the baby and helps regulate the temperature and the blood sugar, and the baby then is given that first opportunity to nurse, typically within the first hour after birth.
Wow. And the mom's milk doesn't really start coming in right away, though.
Right. Mother has colostrum in those early days. The colostrum starts to be produced during pregnancy, and it's readily available to the newborn, and it's always present. It's adequate amounts, because remember, the newborn's stomach is very small, and they don't need a lot to fill it. So, and then typically within about 3 to 5 days, the mature milk starts to come in, and the baby at that point is ready for a little more volume.
Yeah. And you can see the difference. The colostrum, it's kind of yellow, it's thicker.
It's thicker, and it helps just for the baby's tummy to adjust to getting small amounts of fluid, because remember, in utero the baby is not eating anything. They swallow small amounts of fluid, of course. So within a few days, when the baby is ready to tolerate more volume in that small little stomach, the milk comes in.
Yeah,
So.
it's really fascinating when you think about all of it. So how do you know if you're breastfeeding, if you're a new mom, how do you know when the baby has enough, when it's full enough? Because it is kind of a small amount.
That's a good question. That's right. And many moms, I think, feel like that's many new parents' primary concern in those early days is my baby getting enough? Because frequently the babies, sometimes they can be fussy. A lot of times they just want that contact with mom.
Yeah.
Breastfeeding is very comforting for the baby. So many babies want to nurse a lot, and many mothers feel a little frazzled in those early days, like, oh my goodness, is my baby getting enough to eat?
Yeah.
Am I doing something wrong? So that's where we come in and we explain to new moms and dads how to determine if their baby is getting enough to eat. Usually it's, teaching them to determine if the baby's latched on properly, latched on correctly, because, as many people are aware of, it's all about the latch and making sure that the baby is attached properly to the breast. Teaching them to recognize if the baby's swallowing, watching for wet and soiled diapers, wet and dirty diapers, and the baby should appear satisfied after feeding. All babies lose weight in that initial newborn period for the first few days, and then once the mother's milk comes in, the baby starts to put that weight back on. So once she goes to the pediatrician, it's determined that the baby's gaining weight. The baby should appear satisfied after most feedings, especially once the milk is in. Again, watching for the wet and dirty diapers. And the mother will feel some changes in her breasts as well as the milk comes in. The breast will feel fuller and heavier, and then after a feeding, if the baby has fed well, the breast will feel softer.
Yeah. Well, there's a lot to talk about with all this. Luckily, there is a lactation center at Touro, and you guys provide tons of information and some great resources around town as well. Unfortunately, though, we're out of time today. Thank you so much for coming on, though. We appreciate it.
Thank you so much for having me.
And if you want more information regarding National Breastfeeding Awareness Month, the benefits of breastfeeding, and the Touro Family Birthing Center, you can log on to our website, WGNO.com, and click on the 411.